Welcome back. This is SA Today on SABC News. Thank you so much for joining us. Now, the impact of the coronavirus is being felt worldwide. The World Health Organization is working hard to ensure that countries are able to stop the spread of COVID-19. Our Foreign Desk Editor Sophie Mokoena joins us now on the line to give us an update of the coronavirus impact globally. Sophie, a very good afternoon to you. Thank you so much for joining us. Welcome to SA Today. We are seeing more countries taking drastic measures, but are the citizens cooperating though?
Well, it is very difficult, particularly for African countries, to really implement what is being implemented by the first world countries, particularly on lockdown. When you look at the lockdown, you must have a situation where you have people who are willing, or citizens must be willing, to cooperate with authorities. And if you don't get that pleasure where people are cooperating, you then have to evoke or use the law enforcement agencies to compel people to do so on the continent. Because the problems on the continent are not similar to countries in the, developed nations or the industrialized nations. For example, when you take a typical South African example, you have so many informal settlements, you have so many townships, and when you look at infrastructure and the resources in informal settlements and townships, they are not the same as what you get in town. If people want to go and buy groceries, they have to travel. They still have to take a taxi to go to Maponya Mall or to go to Naledi Mall. They can't walk. Therefore, it is a problem because then you don't have transport. Secondly, you do have spaza shops. Even if spaza shops are available, they don't sell in bulk. Therefore, people are moving towards town to go and get these kind of resources or the groceries. And they tend to look for malls. In the malls, then you have this stampede or many people queuing. And as they do that, they don't observe the distance that they have to observe between or amongst themselves to ensure that should there be anyone who's got a virus in those queues, he or she is not transmitting that virus to the other people. And therefore, it's a question of developing world with better infrastructure, a developed world with countries with better infrastructure, and developing countries, but also poorer countries with no infrastructure or where you have challenges. And it is for that reason the World Health Organization has warned the world that should this virus make its way into countries where you have infrastructure challenges and poverty, it is going to be a disaster. And you can already see that it is a problem.
Well, the fear has always been that Africa is not ready. So what's your understanding or your analysis of the African Union doing to ensure that countries are coping? Because I would imagine that it is certainly not enough, just enforcing some of these regulations by force. And the first and foremost and most important thing is to shift mindsets of the people. Remember that we here in South Africa, we come very far from, people dispelling coronavirus as only a disease that is confined to a certain race or to a certain class of people. So in terms of shifting mindsets, do you think that the African Union, in particular the various governments all over the continent, have done enough?
We have 46 countries out of 55 who have reported cases. You have 4,000 positive cases across the continent, 134 deaths, 302 recovery. Now, when you look at the regions, North Africa, Egypt is leading with 576. West Africa, you have Burkina Faso with 207. East Africa, you have Rwanda with 60. Southern Africa, that is SADC. South Africa is leading with more than 1,000. And South Africa is the epicenter of the continent, also the epicenter of the region SADC. But The other issue we must really question is, are the other countries testing vigorously as they should? Because if they don't, then you'll find a situation where there are these cases and we don't know. And therefore, it is upon the AU or the CDC in Addis to ensure that they remind and speak to member countries all the time, every day, to ask them to do the basics: testing, isolate, quarantine, the basic issues that they have to do. And therefore, I think the CDC has a huge responsibility. We saw President Ramaphosa as the chair of the African Union speaking to other members of the assembly, that is Mali, Kenya, Egypt, talking about what needs to be done on the continent to ensure that all countries are working together, but also the AU is giving a leadership. They went as far as establishing a fund to assist poorer countries, and they were able to raise 17 million US dollars. Therefore, now more people must make pledges so that we can have better resources to deal with issues of testing and the protective gear, your mask, and a lot of other needs that the continent must address so that we can be able to manage the spread of this coronavirus. And I think it is very difficult right now. And I think more information, but also the World Health Organization, the regional structure, must work very hard to ensure that they monitor countries to comply.
Now, the World Health Organization, Sophie, has called for more support for the vulnerable countries. Just how is the response so far? Because essentially, we are told to bake a cake. We have the oven to bake the cake, but no ingredients.
It is a difficult one. This is a world pandemic. All countries are now trying to deal with this in their respective countries. Therefore, it is very difficult to mobilize the resource, because all the countries, they want to do testing, they want to quarantine their people, they want to deal with opportunistic disease that are related to this virus, or where this virus flourish or causes problems when people have such challenges of health. And therefore, people are not really coming forward. But in some cases, you do see international support. For example, when you look at what's happening in Italy, 10,000 people have died, 92,000 people have been infected. And we saw Cuba sending its medical team to assist. We saw China doing the same. We are told now Germany is airlifting some patients from Italy to Germany for assistance and to get better health care. We see these very, very remote incidents where there's partnerships and working together. But, for example, we were told this week that America is trying to recruit health officials all over the world. And they will offer them better money. People are likely to go to America. But what are these vulnerable countries doing to ensure that the medical teams in their respective countries, or the health officials, the doctors, the scientists, don't leave their countries for greener pastures? It will be difficult for them to deal with brain drain because they don't have money. And it is a serious health problem around the world.
All right, Sophie, thank you so much for your thoughts. That was SABC Foreign Desk Editor Sophie